Most healthcare providers will usually agree that the journey to a timely claim filing can be tedious and frustrating. From the moment a patient walks into a practice to when they receive the bill, there can be delays, back and forth communication between the provider and payer, and basically no shortage of wasted time. Sometimes those delays are simply due to miscommunication or missing information. Each healthcare plan has their own set of guidelines to follow while submitting a claim, so information can be sometimes lost. So what are some of the reasons claims are delayed? Hi everyone, I'm Maria from eTactics, and today I'm going to talk to you about 4 common reasons for claim delays. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so when we post new, helpful content, you get notified. It's not uncommon for claim delays to be the direct result of missing information. Each healthcare plan has their own set of guidelines to follow while submitting a claim, which can get confusing. Some examples of information needed to file a claim include name of the insurance company, name of the plan holder, group ID number, date of the medical service, and so on. Something as small as misspelling a name can delay your claim for weeks, so it's important to look over your claim carefully before submitting. Making sure that the correct medical codes are being used before submitting a claim can also mean the difference between a timely approval and a delay. For lack of a better word, sloppy documentation by physicians or other care professionals can be the reason for incorrect medical coding. When it is difficult for medical billing specialists to read handwriting and assign the right codes, this can lead to mistakes. I can't put all the blame on you physicians out there. After all, billing specialists enter incorrect information for providers is one of the most common mistakes. This is true especially in the case of emergencies, when gathering data is hurried and not necessarily the first priority. This might be one of the more obvious reasons for running into a delay, but make sure you submit your claims in a timely manner. Keep in mind that this time frame can depend on the insurance used by the patient. Here's a pro tip. If you are unsure about the specific insurance company's filing limits, these companies will publish provider manuals with information regarding submitting claims. The manuals will contain different kinds of information on claim submission and reimbursement processes, including any defined timely filing limit. Prior authorization, sometimes called pre-certification or prior approval, is another important factor to take into consideration if you want to avoid lengthy delays. There are times when payers will require this cost control process in which healthcare providers must be granted permission from a health plan before a specific service is delivered to the patient to qualify for payment coverage. For example, if a physician prescribes a more expensive drug, or drug A, to a patient over a cheaper drug, drug B, that treats the same illness, a healthcare plan may require pre-authorization as to why that physician can't use drug B. If the provider is able to show that drug A is the better option, it may then be pre-authorized. Sending your claim to a clearinghouse before submitting to the payer can save you both time and money. In the event that incorrect information has been included in a claim, a clearinghouse can catch this mistake and alert you to this faster than waiting on a payer to deny it. Contact eTactics if you'd like to learn more about our clearinghouse services. If you'd like to learn more about claim delays and how to avoid them, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share, and comment below.